North Carolina Black Alliance is bringing health and wellness closer to the people. It did so with Rooted in Wellness Day. That was September 28th. It was a statewide event at 11 locations. That's a big lift. And the woman who had all that strength to pull it off is Karita Giddings. She's the healthcare coordinator for North Carolina Black Alliance. Karita, thank you so much for your time, because I know you gotta be exhausted after all that work.
It was a lot. I'm a little tired, but I'm very happy to have it over with, successful, and to have reached the number of people that we reached.
The U.S. Department of Health and Human Services says that 1 out of 10 people in this country does not have health insurance. 1 out of 10. And so that may seem like it's not such a big number unless you're that one person out of that 10. As you are in community doing your work, what are you seeing in that regard as far as access to healthcare?
So usually what I see is that access looks very different for many different people. So when you mentioned that, just the one may not feel like a lot, you don't know if part of their situation that they're carrying is just not having health insurance, or is it also not having access to healthy food options? Is it also not even having transportation to get to the doctor in the first place, whether one exists in your county or it's about 30 miles away from where you live? And so in this work, we're finding that you can't specify a specific situation for one person. It looks very different. And a lot of times we refer to that as the social determinants of health. So we're not just talking about health insurance or the availability of providers and healthcare. It's really all of the above. It's all the social and economic factors that play a role in people's ability to live a healthy life and improve their well-being.
So that explains why you had all of those locations, the 11. Give us a rundown of what was happening at each of those sites.
So at each location, what you really saw was a community event really tailored to the community needs. So certain places had mammograms. That was based on the availability of a mobile unit to go to their communities. Some places had dental screenings. Some places had doulas who are really doing a great job of getting deep into those communities that are experiencing shortages and lack of access to healthcare. And so what you observe when you kind of look back and reflect on September 28th, you saw a community providing mutual aid, meeting members of their community where they were at based on the needs that our community stakeholders recognize were not being met by the traditional healthcare system.
What you're describing, Karita, is proactive healthcare. Was that the idea behind this year's theme, moving our community from surviving to thriving?
Absolutely. So a lot of times I feel like when we're meeting and talking to our community partners, one thing that comes up is a lot of times we're just getting people the bare minimum. For example, this past year we saw Medicaid expanded, and that did meet for a lot of people the minimum of just having health insurance. But we have to take it a step further, and that's where the conversation about moving our communities from surviving to thriving sought to get at. Is there are basic needs that we all need, that all of our communities need, but because of the history of discrimination in our country, we really have to take it a step further for Black and Brown communities.
Well, Karita, you make the distinction between a health fair and a wellness fair. What's the difference?
I would say a wellness fair, it's intended to capture all the dimensions of wellness, right? Not just the healthy eating, the health insurance part, right? But mental health, your physical health, even your financial health and wellness, because they all play a role in the decisions that we make around our housing, our food, and our health care.
For those who attended Rooted in Wellness Day, what was it designed to do? And what was Rooted in Wellness not designed to do? And I'm asking that because what if I'm trying to save that $20 I would have spent on a co-payment to my primary care physician and you say, I went Rooted in Wellness Day, I'm good.
So Rooted in Wellness Day was intended really to provide mutual aid, meet community members where they are at. Providing some essential baseline health screenings ranging from blood pressure, dental checks, and even some other heart health screenings. And so The difference I would say between maybe somebody who is considering using that $20 for their copay as opposed to going to Rooted in Wellness Day, you might be more motivated to go to Rooted in Wellness Day because at Rooted in Wellness Day, you see trusted members of your community that have created a safe space for you to access the different dimensions of wellness, as opposed to you're not always met with friendly faces, trusted faces when you enter into the traditional healthcare system, especially in places where the nearest hospital or healthcare facility isn't even in the community that you reside in.
So not a replacement, but a good supplement.
Right.
Karita Giddens, thank you so much for putting this together for us. Sounds like a whole lot of work. So you get you some rest now, okay?
I definitely will. Thank you.
All right, thank you.